Welcome back to Simply Women's Health with CJ. Today we're going to talk about Pap smear results. So you went to your well-woman exam, you had your very appropriately timed Pap smear done, you logged on to your patient electronic chart, and you saw your results, and now you're not quite sure what those results meant. So today we're going to talk about results, and hopefully this will answer any questions that you might have. The first thing you're going to see on a Pap result is going to say satisfactory for evaluation. Basically, that means that your clinician got enough cells on your Pap screening for the cytologist to take a good look at it. Sometimes you'll log on and you'll see unsatisfactory. That doesn't mean there was a problem. That just meant that they didn't gather enough cells when they did your Pap smear for the cytologist to make an accurate diagnosis. The standard of care for that is to repeat the Pap in 2 to 4 months. You might see a Pap that says negative for intraepithelial neoplasia or malignancy. That is just a normal Pap. It means that they didn't see any abnormal cells on your specimen whatsoever. The standard of care is to repeat that Pap in either 3 to 5 years, depending on your age and what your HPV result was if they did an HPV co-test. The next set of results are going to be more of your abnormal results. And the way that I like to explain it to my patients, the first thing I do is I draw a cervix. And I explain that the way that the cervix is built, the cells closest to the surface of the cervix are really, really flat in nature. And as you go down into the cervix, the cells get a little bit bigger, a little bit bigger, a little bit bigger, and then they become ginormous. Ascus, atypical squamous cells of undetermined significance. Atypical, not typical. Squamous cells. Those are the kind of skin cells you have on your cervix. The human body has 2 different kinds of skin cells. We have basilar, which are the cells that are on the outside, and you have squamous cells. Those are the cells that are on the inside. So if you think about it, the cells inside your mouth, inside your vagina, and inside your butt are different than the cells on the outside. These are squamous cells. These are basilar cells. Undetermined significance. Ascus is kind of a non-conclusive Pap result that just says, well, we saw some atypical cells. We weren't quite sure what they meant. Ascus, as a rule, tends to sit very superficially on top of the cells. So the cytologist saw these flat cells, but they just didn't look quite right. The next level up is LCIL, low-grade squamous intraepithelial lesion. Low-grade, low level of suspicion for cancer. Squamous, again, those kind of cells. Intraepithelium, this is an epithelium, meaning the cells go down a little bit deeper. So when the cytologist looks underneath the microscope, LCIL by definition goes 1/3 of the way into the cervix. So the cytologist, when they look underneath the microscope, sees these medium-sized cells. Next level up is HCIL. High-grade squamous intraepithelial lesion, high level of suspicion for cancer, squamous, again, those kind of cells. Intraepithelial lesion, high-grade by definition goes 2/3 of the way into the cervix. So the cytologist sees these bigger cells. Then you have your big bad mamba jamba carcinoma in situ. These are your precancerous cells. When the cytologist looks underneath the microscope, they see these gigantic cells in their entirety. Anytime you have abnormal cells, they are going to look for the presence of human papillomavirus. Depending on the level of abnormalities, keeping in mind the further down it goes, the more worrisome it is. If you have abnormal cells and you have a positive HPV co-test, again, depending on your age and your situation, your provider may recommend that you have a procedure called a colposcopy. For further information regarding either HPV or colposcopies, please check out my videos that I have produced regarding each one of those topics. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your service.